Hi there, I'm Abby Dykehouse, LCSW Care Manager from the Avis Group. Today we're going to be talking about how you can utilize your time with your primary care doctor in your annual wellness visit. These days, Medicare hasn't set a specific time limit on what they will pay for, but the average time right now is about 20 to 30 minutes. And you can tell that's not a lot of time when you're speaking about your health and your well-being. And sometimes my clients come back saying that they felt too rushed and that they completely forgot to say what they wanted to say in those spaces. So I'm going to give you a few quick tips on how to prepare and utilize your time when you are in that primary care doctor's visit. Number one, of course, it's going to be very obvious, but very needed, is be prepared. I want you to go and weeks before your visit, I want you to keep a little bit of a journal every day. You can write down how you're feeling. You can write down if you had any symptoms like dizziness, extra tiredness, any type of feeling off. I want you to make note of it. And of course, if you do already have some sort of diagnosis that you are feeling the symptoms are getting stronger or worse, definitely take note of that. Of course, big elephant in the room is blood pressure. Oftentimes as we get older, blood pressure can be a factor. So if you know, and you have been told in the past that you have issues with your blood pressure, I want you to have a little bit of a journal where you keep your blood pressure on a daily basis, and then you can take those readings and you can give the doctor your readouts or your written readings. So that's really important. Be prepared. Then once you get into those spaces with the primary care doctors, the most important is to be your own best health advocate. Oftentimes we like to shoot the breeze and take the first 5 minutes talking to our doctor about how their kids are or how their vacation was. That's fine and dandy. I know that you guys have a standing relationship in many cases with your doctors, but this is valuable time. So keep those comments, that conversation in the beginning to a minimum, and then I really want you to dive in, and I want you to be your own best health advocate, and you need to be assertive in telling the doctor what your symptoms are, what you're experiencing. Give them all of the data that you may have collected about you feeling more tired or blood pressure drops. You need to ask for help. If you hem and haw and you're not specific and you don't want to make a big deal out of things, then nothing will get done. But you should utilize your Medicare coverage. You've bought into this your whole life, so let's utilize. And you can do some research on the back end too. That's another really good point, is that there's so much technology out there nowadays. You can maybe ask AI or do a Google search on what any of your symptoms may be showing you. And that, again, you don't want to diagnose yourself, but you do want to go into these conversations, maybe bringing up the idea that you need a specific lab test. And your doctor, if they don't think it's appropriate, will say no, but you should advocate for yourself in these meetings. So again, first and foremost, I want you to be prepared. I want you to keep a journal of your symptoms, how you're feeling, especially if you have a pre-diagnosis where you know that you should be looking at something like high-low blood pressure or sugar from your blood. If you have diabetes, you should have a little bit of a journal, a little bit of data going back several weeks so that you can present that data to your doctor to make sure that everything is on baseline. And then I want you to go in there and utilize your time. Remember, you only have 20 30 minutes tops. So keep the chitter chatter and the beginning to a minimum, and then dive right in and be your own best advocate. If you do some research on the back end, that's also very helpful, and maybe present that research to your doctor about what you found and ask for tests. Don't be afraid to ask for lab tests or any specific testing that you feel you may need. Because if you go in there and you just say, well, I've been a little tired lately, but I'm okay. If the narrative is that you're okay, then the doctor will not run the labs. This is where you have to be your own best advocate. Push for yourself, because at the end of the day, you want to catch anything that you may be having, any type of diagnosis, any pre-diagnosis. You want to catch it in the beginning so that you can live a happy, healthy, long life. Thank you so much. I'm Abby Dykhouse from the Avis Group, and I hope this helped.